You can't say, yeah?
You cannot tell me that it's a workout. An activity, maybe. I'll buy that. But a workout?
Yoga is an intense workout.
Intense. Oh, so now it's an intense workout. Melissa, you don't even do anything. You stand there. You don't even break a sweat. You're on a little mat.
Okay,
like
first
humming.
of all, there is no humming. First of all, there is movement. There's breathing. You do sweat. I'm telling you, by the end of the class, I'm exhausted.
You're exhausted.
Yes.
So now it's an exhausting, intense
yes,
workout
that's
while
exactly
standing
right.
in one place on the mat.
But it doesn't always have to.
So what's the argument today?
Mark doesn't think that yoga is a workout.
Is it? Is yoga a workout?
Well, I say it's an aerobic activity.
Activity.
No, it's definitely a workout. Well, then again, when I used to go to yoga class, I didn't tell people that I was going to go work out.
So, am I right?
Listen, okay, you're both right. You're both right.
Man, you know.
Okay. Today, we're going to focus on perioperative care. Okay, now there are activities that we can teach a patient preoperatively to help him avoid post-op complications. Okay, now, who can tell me what these entail?
Deep breathing and coughing exercises.
Good. And? Who else?
The
Come on.
use of an incentive spirometer as well as splinting of the chest and abdominal incision.
Good, good. Come on.
Leg exercises and turning in bed.
Very good. The most common postoperative complications involve the cardiovascular and respiratory systems, and these activities can reduce the risk of these complications. It's a little bit like yoga, Mark.
Oh, man.
Okay, I'd like to go with Melissa to her first patient. Mark and Katie, you continue with your patients, and we'll just check in later, okay?
Okay, great.
Sounds good.
Okay.
It's an activity.
Come on, workout. Workout.
And then that's it.
Wow. Now, Melissa, you have a patient going for lung surgery tomorrow, correct?
That's right.
So we'll have to focus on what she needs to know to recover more quickly. Now, at the end of our teaching, she should be able to tell us about the activities and demonstrate them to us correctly. That's our goal. So, Melissa, you take yoga.
Yes.
Yes, and a lot of breathing is in that, right?
Yes.
So tell me, what's the importance of the deep breathing exercises post-operatively?
Well, deep breathing exercises hyperventilate the alveoli of the lungs and prevent their collapse.
That's right, and it also improves lung expansion and volume. It helps get rid of anesthetic gases and mucus from the airway, and of course aids the oxygenation of body tissues.
Right, I remember that from class.
You do? Good for you.
Now, the patient is a little bit anxious. Her family's been visiting with her all day, and her sister's in there right now.
Good. What we'll do, we'll take this time to review her preoperative teaching with both of them.
Okay.
Okay.
All right.
All right.
Hello, Miss Triple.
Hello.
This is my nursing instructor, Miss Scott.
Hi, Miss Triple.
Hello.
She's going to be watching us go over a few things so you know what to expect after your surgery.
Oh, good, because I do not want any surprises.
Okay, well, these exercises will help you recover faster and help prevent complications.
Excellent. Phyllis, please take some notes.
I'm watching carefully.
Oh, and you should know that I am a very physically active woman. I'm a dancer and a choreographer. And I don't just sit in my chair and bang my cane on the floor like some dance teachers do.
Okay.
I actually get up in there, so I am a strong woman.
Well, I think that's going to help a whole lot. So I'm just going to check your ID band. Is that okay? All right. So we're going to start with the deep breathing exercises first, okay?
Okay.
All right. So I'm going to need you to sit up and then move your bed a little bit. Sorry, Phyllis. Okay. Okay. Now, this is what we call the Fowler position, much like the first position in ballet.
Oh, dear. You're a dancer.
No. No, just for a few years. My sister's the artistic one. She's the one going to school for dance now. But I've been to enough of her recitals to write a book. So, you're in the Fowler position. Now, you're going to put your hands on your rib cage, like so. Okay, this is so you can feel your chest rise and your lungs expand. So I'm going to tell you, and then we're going to go ahead and do it. So you're going to exhale first, and then you're going to breathe in through your nose. You're going to hold your breath for 5 seconds, and I'm going to count. And then you're going to breathe out through your mouth with pursed lips, like you're whistling.
Okay.
Okay? So go ahead and give it a go. Exhale. Breathe in. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000. Right, great. And you're going to do that 3 times, and then you count. So go ahead.
All right.
Good. Good.
That is relaxing.
It is, right? It's very good. So you're going to want to do this every 1 to 2 hours while you're awake for the first 24 hours after your surgery. Okay? Any questions?
So she needs to just do this every 1 or 2 hours?
Right. The frequency might change according to risk factors or her lung status, but for now we're going to say every 1 to 2 hours. Okay? Anything else?
No, it seems pretty easy.
Okay.
Very good job. Melissa, why don't you talk to her about splinting and coughing?
Right. Okay. So after the deep breathing, we go on to coughing. Now this is to get the mucus that might be in your chest up and out.
Oh, like a sailor. How attractive.
I know, it sounds a little strange to do so, but it's really important. So when we do the deep breathing and the coughing, it's important to provide support to the incision, and this is what we call splinting the incision. This is to reduce any kind of pain you might have when you take a deep breath, when you move in your bed, get out of your bed, get out of a chair. So you can use a pillow or a bath blanket. About the bath blanket. Now you're in the right position. You got to be sitting up. I'm going to need you to lean forward. Now we're going to place this on the side of the chest because that's where your incision is going to be.
Okay.
So right, and your instinct to come down on it like that. Yes, exactly. Squeeze. It's important to apply firm and consistent pressure on the incision.
Okay.
Wait, is that good to do over an incision? Won't it hurt her?
No, not at all. I mean, you can't damage an incision by pressing on it. All splinting does is decrease her discomfort.
Okay.
Okay, good.
Okay, good. So inhale and exhale through your nose 3 times. All right, great. So you're going to inhale through your nose, you're going to hold it for 3 seconds, and we're going to count like we did before, and then you're going to let it out 3 short hacks, like, right?
Okay.
Okay, so inhale. 1, 1,000, 2, 1,000, 3, 1,000. Right, good. Now you've got your mouth open, so with your mouth open, you're going to take a deep breath, and then you're going to cough twice strong, like a sailor, okay? So go ahead. Good, very good.
That
That's
was
perfect.
good. Yes.
So you want to do this exercise every 2 hours while you're awake, okay? Any questions?
So you're sure this isn't going to hurt her in any way?
No, this is completely safe, and it's really important that she does this.
Okay.
Okay, great. Get this out of your way.
Melissa, let's be sure to document any observations,
Right,
any
okay.
teachings, any of Ms. Tripple's responses.
Okay.
Just put it right there. Good.
Oh, I see here you have a history of asthma.
Yes, I do. Is that a problem?
Well, it increases your risk of lung complications after surgery. So your physician has ordered an incentive spirometer for you beforehand so you can learn how to use it.
What's the incentive part? It sounds like a car commercial.
That's a good question, Miss Scott.
Let me help you out with that, Melissa. You see, using an incentive spirometer after surgery can help prevent breathing problems like pneumonia. See, it basically helps you take deep breaths. Why don't you tell her how it's used, Melissa?
I'm all ears.
Okay. So here's the incentive spirometer. Take it out of its wrapping. Here, you're going to hold this part.
Okay.
Here's the tubing. We're going to place it over the opening, like so.
Good.
Firmly.
Okay.
Okay. So you're going to exhale, and then you're going to put your mouth here on this little trumpet part. Make sure that it's a tight seal. And then you're going to inhale deeply, hold your breath for 3 seconds, and your goal is to get the first 2 balls up to the top. Okay?
Okay.
All right. So give it a shot. Exhale, right. Very good, very good. Now make sure to take a break. Breathe slowly for several breaths. Right. Now you're going to want to repeat this 5 to 10 times every 1 to 2 hours that you're awake. And each time you want to reach your goal of getting the first 2 balls up to the top. Okay?
Okay.
Any questions?
Well, it's just breathing. I've done it before.
This is important, sis. You have asthma. It's very important for you to keep your lungs working right.
Thank you, Phyllis. I mean, now we'd like to go over another activity that you'll do after surgery to help you get better faster. Melissa, why don't you help her start her leg exercises?
Okay.
You see, leg exercises will help you get better faster after surgery because they keep your muscles strong and they help pump blood back to your heart. Melissa, can you help her with this and show her how to do it?
Okay, so first we're going to get you in semi-Fowler's position. So I'm just going to lower your bed a little bit.
All right.
All right. Okay. Now, we're going to do this one leg at a time. Move this bath towel over here, and I'm going to pull back the covers so you can see your legs. Okay, you comfortable?
Sorry, there.
Okay, so I need you to bend your knee.
Bend my knee.
Right. Now, elevate the leg, keep it up there for a few seconds, extend, and down. Very good.
Please, that's a piece of cake.
So let me see you do it another time with this leg then.
All right.
Okay. Great. Down. Now to this leg. That. And
again?
one more time, yeah. Make it even, right? Great. Perfect. The next exercise is going to involve using both your legs. So I'm going to need you to point your toes. Try to touch the other bed. Point. And relax. And now you're going to pull back your toes, flex your feet, and relax. You're going to circle to the right. And now circle your ankles to the left.
Good.
And you repeat this 3 times, so I know that you got them all.
Oh, all right. 5, 6, 7, 8.
All right. 1, right.
Down.
Good.
Point.
Relax, and
Right. Great.
Now, Ms. Triple, the last thing to go over is turning after surgery. Now, movement with a surgical incision can often cause quite a bit of pain, but frequent turning in bed as well as walking as soon as possible can help prevent a lot of complications after surgery.
and that is what we want.
Exactly.
Right. So let's practice how we're going to help you turn in bed after surgery.
Well, let's roll.
All right. So I'm going to need you to bend your knee, this one right here. Right. And we're going to have to splint the incision like we practiced earlier. And the blanket again.
Okay.
Place it over where the incision would be. Right.
Same,
Do
okay.
the briefcase move. Okay. Now with this arm, you're going to reach over and grab the side rail. And you're going to pull with this arm and push with your foot to roll over. Okay. And I'm going to help you. Okay. Ready?
Okay.
1, 2, 3. And go. Right.
Okay.
Perfect. That's
Okay.
perfect.
Here
And
you
now, going to put a pillow back here to apply support to your back. And as you can see, the call button is right within your reach.
Oh, yes, that's great.
And with the pillow here, just give it a little tuck so it can stay in place. There you are.
Oh, that's
very
good,
good.
yeah.
Okay?
That's good.
Great.
Great.
And you'll want to turn and change positions every 2 hours. Okay? Do you have any
Okay.
questions?
No, I think you've covered everything.
Okay, great. Let me get this out of your way.
Well done, Melissa. Very good job. We're going to leave you now, Miss Triple, and we'll be checking in. And you let us know if you can think of any questions. Okay?
All right.
Thank you so
Thank
much.
you. Thank
You're
you
very
so
welcome.
much. I
You're
appreciate
welcome.
everything.
No problem.
Okay.
Bye.
Oh, thank you, darling. I think so.
Melissa, you were great with your patient. Oh, she seems to feel so comfortable with what she has to do after surgery.
Thank you very much.
Very
So
good.
for tomorrow, when she's able to cooperate, the nurses will use the same postoperative activities that we taught her.
Yes.
The leg exercises, deep breathing, coughing, and turning.
Yes, exactly. Well, it's important to reinforce teaching with the patient and the family. All right, I'll check back with you later.
Okay, thanks,
Good
Ms. Scott.
work. Thank you. Mark, how are you making out?
Well, I just got a call from the surgical suite, and they want one of my patients transported to the operating room in 60 minutes.
Okay, now, on the day of surgery, we have interventions that are geared towards ensuring patient safety. Can you show me where we can find our responsibilities and interventions?
It's in the preoperative checklist.
Let's see here. Okay.
And we send the preoperative checklist along with the patient chart down to the operating room.
Very good. And did you confirm the doctor's orders for the surgery?
Yes, I
Let me
did.
see. It should be here in the chart. Ah,
Right here.
there it is.
Everything's okay. Looks good.
Good. Very good, Mark.
Thank you.
Okay, let's go get our patient ready for surgery. Okay. Got everything?
Yep.
Good.
Okay.
Hello, Mrs. Rogers.
Hi. Oh, you know my husband, David, right?
Yes, we met in the hallway. It's good to see you again.
Good morning.
Hi. Nice to meet you.
Nice meeting you.
Oh, this
too.
is my nursing instructor, Miss Scott, and we're just going to go over a last checklist to make sure everything's been done before surgery.
Okay. Good.
Okay, first, I'm just going to confirm the information on your ID bracelet.
Very
Make
good.
sure that everything's correct. It is, thank you. Now I'm just going to check the consent forms and make sure that they are signed, witnessed, and correct,
Okay.
which they are. now I'm just going to take a look at the patient chart and make sure that all the medical records are in order.
Good.
And they are.
Well, I've crossed my T's and dotted my I's.
Good for you.
Okay, now the OR called, and they will be ready for you soon. So there's just a few things that we need to do before you're ready to go.
Shoot.
Well, first thing, Mrs. Rogers, we're going to take your vital signs and to assist you with any personal oral hygiene you need, okay?
Excellent.
I need to ask you to get out of your personal clothing and put on a hospital gown, okay?
Okay.
All right?
We're all set. Okay. Okay, well, we have your vitals. Now we just need to go through our checklist. Do we have to remove any prosthetic devices?
I'm all natural.
Okay, dentures?
You know, like I said, all natural.
Okay, makeup or finger polish?
Nope.
Okay, hairpins or hair pieces?
All natural.
She is all natural.
So no body piercing.
Well, I do have this. No. No.
Great, but what you do have are those eyeglasses and your bracelet and your ring.
You know what? We can store them in the hospital security department or safe because we have to make a disposition of them before sending you to surgery anyway.
It's
So we
okay.
don't mind. You sure?
Yeah, it's okay.
You sure?
David
We
can
don't
hold them
mind.
for me.
Oh, okay.
Okay, great.
Fine. Okay.
And Mrs. Rogers, you've been to the ladies' room to empty your bladder, correct?
I have.
Okay, wonderful. And I've also noted any allergies according to policy.
Good.
And I've also checked to see if we have to administer any other preoperative medications that may have been prescribed by the physician or the anesthesiologist.
So were any prescribed?
Nope.
None?
We don't. No.
Okay. So all we need to do is check the identification between the chart and ID band with the transport person, and then we'll be ready to go.
Okay.
Okay?
Great.
Mark, I'm going to move this out of your way. Okay. Oh, here they come. All right.
Hello, Miss Rogers. My name's Brendan. I'll be transporting you to OR.
Okay.
Can I see your ID bracelet
Sure.
and your name?
I'm Helen Rogers.
Okay. Can you have a seat on the stretcher?
Sure.
Okay, I'm just going to put the side rail up for you.
Okay.
And I'm gonna cover you up.
All right.
You stay in the stretcher now, all right?
I think I'll be okay.
Okay.
I'm not going anywhere.
Like you have
Oh, sure.
Mark. Mark, now is a good time for you to talk to David and tell him what he needs to do, okay?
Okay.
All right. You know what that is, don't you?
Mm-hmm, sure.
You sure?
Yeah.
Okay, go talk to him. Go on.
David, excuse me. Hi. Your wife will be spending some time in the post-operative recovery area after surgery before coming back here. And the surgical waiting room is down the hallway to the left, and Miss Scott will actually take you there.
Okay, fine.
Okay, and the surgeon will meet with you in the waiting area after the operation just to speak with you.
Great.
Okay?
Yeah.
So, David, why don't you wait for me in the hallway and I'll be with you shortly, okay?
Okay.
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 Okay. So, Mark, while I am escorting David to the waiting room, what I need for you to do is to prepare Miss Rogers' room for post-operative care, all right?
Okay.
And that's even the post-op bed, everything.
All right.
Okay? Oh, also, I need for you to anticipate any needs for special equipment depending on the type of surgery she's receiving and by looking at her medical history.
All right.
Okay, do you know what these are?
This would be any equipment to check vital signs.
Good, good.
Deliver oxygen or administer IV fluid.
Wonderful. Okay, so I'll be right back.
Okay.
You get this done.
I will.
See you in a minute.
I'll see you.
Can you tell me what happens to a patient after surgery and how that affects us?
Well, after surgery, the patient spends time in the post-anesthesia care unit, or the PACU, and from the PACU, the patient is transferred back to their room.
Then what?
Then we can focus on any actual problems or anticipated problems that the patient may be at risk of developing.
Good. I tell you what, let's take a break and we'll meet back together later.
Yeah.
Sounds good?
Sounds good.
Okay.
I'll see you later, Miss Scott. Thanks.
All right.
Miss Scott, how'd she do?
Oh, Mark. The surgery was successful. Oh, she's
Good.
now spent 2 hours in PACU recovering from anesthesia without any complications. And she's on her way back to her room.
Okay.
Now, while you're here, tell me, what's the first thing we're going to do?
The first thing I'll do
Yes.
is help the transport person in transferring the patient back into her bed.
Very good. Well, I tell you what, just follow me and we'll get her set up. and we'll obtain a report from the PACU nurse, and we'll review the OR and PACU data, and then assess her.
All right, I'm with you.
All right, let's go. Okay. Mrs. Rogers, you're back in your room now. Hello, Mrs. Rogers. Okay.
Hello, Mrs. Rogers. Hi, this is Mark, your nursing student. We're just going to get you comfortable in your bed now, okay?
Okay.
All right.
All right, let's get her over. All right, let me get up here a little bit. And support her shoulders. Yeah, we should put her head. Okay, on the count of 3. 1, 2, 3, and over. Very good. Okay, Mark, while we're doing this, can you tell me how we position her in her bed?
In a safe position.
Good.
Either the semi-Fowler position or the side-lying position.
Very good. And tell me, how often do we take her vital signs?
That would be every 15 minutes for the first 30 minutes, and then every 30 minutes for the next 2 hours, and then every hour for the next 4 hours, and then every 4 hours.
Good.
But I would check with the hospital's guidelines.
Very good. Now listen, what we're going to do is pull her up in bed first.
Okay. Mrs. Rogers, we're just going to move you up in the bed now.
On the count of 3. 1, 2, 3, and up. Good. There we go. Now let's make sure she's nice and warm.
Does she need another blanket?
Yeah, here's one right here. You see, it's very cold in the operating suite, and the things that they were doing to her, many of the interventions caused her body temperature to lower, you know. Let me put this on here. Now, what I want you to do is to be sure to assess her skin color.
She is a little pale.
Yes, she is.
But her skin is warm and dry.
Good. We need to check the dressings for color, odor, and amount of drainage, okay?
Okay.
All right, so go ahead and do that.
All right.
Good. All right.
And we should mark any drainage on the dressing for future comparison,
That's right.
Okay.
Now, why don't you feel and look up under the patient and see if there's any drainage coming from the incision site, any bleeding, anything.
Okay. Are you feeling any pain, Mrs. Rogers?
No.
Okay.
Okay, good.
All right.
Okay, we will also verify that the tubes and drains are patent, if there are any, which there aren't.
Okay.
And we also want to check that any equipment is in place and operating properly, all right?
All right. And we should also check the IV solution rate.
Right, right.
And make sure that the IV infusion is at the prescribed rate.
Good, good. And be sure to monitor her urine output.
Okay.
Okay, is the bag placed right? Okay.
Yep.
And output's okay?
Yep.
Okay, now tell me this, did we provide a safe environment for this patient?
Well, the bed is in a low position.
Okay.
The side rails are up.
Good.
And the call bell.
I'll put it there. All
Easily
right.
within reach.
It is.
Mrs. Rogers, we'll be back to check on you in about 15 minutes. So if you need anything, you just ring that bell, okay?
Hi.
How's she doing?
She's doing okay.
Okay.
David, if you need anything or you have any questions, you just ring that bell and we'll be right up to help you.
Can do.
Okay. Mark,
Baby.
let's document our assessment.
Okay.
Good.
So what exactly is pneumatic compression devices?
Well, hi, Katie.
Hi.
I was just talking to Melissa about pneumatic compression devices. Do you have a minute?
Yeah.
Okay, good. Can you tell her about your patient?
Sure. Actually, my patient had hip replacement surgery, and they ordered a pneumatic compression device, a PCD, for his legs.
Oh, well, can you tell us how it's used?
Sure, the PCD will enhance blood flow and venous return in his legs and promote fibrinolysis in order to prevent venous thrombosis. Did I get that right?
Yes, you did. You most certainly did. Now, the sleeve may cover the entire leg or may extend from the foot to the knee. PCDs may be used in combination with anti-embolism stockings and anticoagulant therapy to prevent thrombosis formation. Now tell me, what should we assess before we put them on?
Well, we assess skin integrity to identify any existing leg conditions that might be made worse by use of the compression device or that might contraindicate use of the compression sleeves. And I already checked and we're fine to put them on.
You just like using the word contraindicate.
I do.
Okay, do we have the appropriate equipment here?
Okay. You need compression sleeves of the appropriate size, an inflation pump, and connection tubing.
Good. So let's head over and we'll speak to the patient and explain the procedure since there's nothing to contraindicate using the sleeves.
You like contraindicate too?
Well, I think it's a nice word.
I'll see you guys later.
Bye.
Hi, Mr. Reynolds. This is my instructor, Ms. Scott. And I've got those special stockings I told you about.
Hello, Mr. Reynolds.
Hello.
Oh, new flowers?
Yeah, from the office.
Aw. Katie, why don't you hang the inflation pump there at the end of the patient's bed and give me the plug so I can put in an electrical outlet. And what I'm going to do now is raise the bed to a more comfortable working height. Very
Great.
good. And now you can tell me, what do we do with compression sleeves?
Well, we remove the compression sleeves from the packaging,
Yes.
unfold them, place them on the bed with the inner liner facing up.
Good. Place the sleeve under the patient's leg with the tubing towards its heel. Okay, each one is for either leg. That's perfectly all right. Now, what is the difference between total leg sleeves and knee-high?
Knee-high is more sexy. I want to feel young.
If you say so, Mr. Reynolds. Well, actually, for total leg sleeves, you place the behind-the-knee opening at the popliteal space here to prevent pressure there. For knee-high sleeves, the end of the sleeve is above the back of the ankle.
Wrap the sleeve snugly around the patient's leg. Good. 2 fingers should fit between the leg and the sleeve. They have Velcro fasteners. And just repeat for the second leg if bilateral therapy is ordered. Okay, Katie, now?
Now I'm going to connect each sleeve to the tubing for the pump.
Good. Just be sure to follow the manufacturer's recommendation for connecting. Good. Excellent.
So then I set the pump to the prescribed maximum pressure,
And what is the usual maximum pressure setting?
35 to 55 millimeters mercury. We make sure the tubing is free from kinks and that the patient can turn about without interrupting the airflow. So now I turn on the pump?
Please.
Okay.
What do we do for the first cycle?
We observe the patient and the devices, check the audible alarms, and check the sleeves and pump at least once per shift.
What do we do when the sleeve is removed?
Well, when we remove the sleeves, we assess and document skin integrity every 8 hours.
Very good.
Oh, also, we assess the extremities for peripheral pulses, edema, movement, and changes in sensation.
Good, good. Okay, let's set the bed in the lowest position with the side rails up. And always be sure that the call bell is within reach and all other necessary things the patient needs, okay?
Okay, right.
Okay, thank you very much, sir.
Let's make sure that we document the time and date of application of
Okay.
the PCD, the patient's response to the therapy, and his understanding of the therapy. Also document the status of the alarms and cooling settings.
Very good, Katie.
Okay.
Your patient is bleeding. Great job. Good work.
Thanks.
Thank you.
Now, as we've seen today, surgery can be a very difficult experience for people to go through, both emotionally and physically. And an important part of nursing care is to prepare patients for what to expect and to help them recover. Okay, now, does anyone have anything to share from today? Anything?
Yeah, I do.
Okay, Mark, go ahead.
Well, a tough one for me is when I was assessing a patient who had a colon resection about 2 hours before.
Okay.
Well, I went in to speak with him, and he was awake, but he was still a little bit groggy because of all the anesthesia. Well, I went to check the dressings, and I noticed, although it was a large dressing, it had been completely saturated all the way through. Oh, my goodness. Yeah, and there was even a ring of blood under his back on the sheets.
What did you do?
Well, I assessed his level of consciousness and vital signs, including oxygen saturation.
Good.
Also, I looked for any other symptoms or complaints, including, pain or difficulty breathing, and then I notified his nurse.
All right.
And then I spoke with the patient's surgeon and reported my findings immediately. And then I went back and reinforced the dressing with additional layers of dressing material.
Yes, that was the right thing to do, Mark. You assessed for other factors and you communicated your concerns. You held your own. I am proud of you. Good
Thanks.
job. Good job.
Thank you.
Okay, Katie,
Well, I received a patient from the PACU, and I was performing my initial assessment. And then the patient turns to me and says that she's in this terrible pain.
Okay.
The look on her face, I mean, I'll never forget it.
So how did you proceed?
Well, I performed a complete assessment, including having the patient rate her pain using the pain scale.
All right.
Then I assessed the surgical site. I tried to relieve the pain by repositioning her in the bed.
Anything with the PACU?
Oh, yes. I checked the PACU record to validate any analgesic given in the PACU.
Good.
And then I checked the postoperative orders for PRN analgesics.
See?
The patient received analgesics in the PACU, so I confirmed the frequency and made sure the correct time had lapsed between doses.
Well, had it?
Yes, enough time had passed since she received an analgesic in the PACU, so I was able to administer an analgesic as ordered.
Oh.
Now, Miss Scott.
What?
What happens if a patient had pain medications in the PACU, but he was still in pain, but not enough time had lapsed?
Good question, Mark. You would contact the surgeon to address the patient's pain. Easy as that.
Okay.
Okay?
Yeah.
Excellent. You encountered some interesting situations and used appropriate interventions. Well done.
Thanks.
You all did a great job with this. Your patients are all recovering well, and you cannot ask for anything more. Okay, any more questions or concerns?
No.
Okay, then. You all have a good night, and I'll see you all tomorrow.
Okay,
Great.
See you, Miss Scott.
See ya.
Okay, bye.
So I got to work with a dancer today.
Really?
Yeah, the little, with the exercises and the lung surgery and all that kind of stuff. Yeah, and I use my yoga.
Uh-huh.
I've heard
You know what? No,
Comes
no,
in
Miss
handy.
Scott told me to
Comes
use it.
in handy.